start off our detailed physical examination, I'm going to assess the head for DCAP BTLS, which is deformities, contusions, abrasions, penetrations and punctures, burns and bruises, tenderness, lacerations, and swelling and scars. So I'm going to start off with the head. I'm going to palpate for any instability, crepitus, and tenderness. I'm going to also assess for to see if the head and the face is asymmetrical. I'm going to look for any signs of raccoon eyes. I'm going to look behind the ears to see if there are battle signs. I'm going to look for soot and or singed nasal hairs or facial hairs. And then I'm also going to look for coffee ground emesis. Great. Then I'm going to move on to the neck. I'm going to assess for DCAP BTLS. I'm going to palpate for any tenderness, instability, or crepitus. I'm going to check the carotid pulses. I'm going to look for any track marks and tattoos. I'm also going to be looking for any medical alert tags. I'm also looking for jugular vein distension, and then tracheal deviation. I'm also going to be looking for accessory muscle use. I'm also going to look for subcutaneous emphysema and then stoma. So now that I'm done with the neck, I'm going to move on to the chest. Okay, so for the chest, I'm going to assess for DCAP BTLS. I'm going to palpate for tenderness, instability, and crepitus. I'm going to look for any paradoximal movement. Read. I'm going to also be looking for accessory muscle use and then a second chest wound. Okay. I'm also going to be looking for subcutaneous emphysema. Then I'm going to auscultate breath sounds in all fields of the lungs. Okay, we just did that. Okay. So, moving on to the abdomen, I'm going to assess for DCAP BTLS. I'm going to only palpate for tenderness. I'm going to look for any signs of distension, rigidity, or guarding. I'm going to feel for a pulsating mass. I'm going to look, because my patient is a female, so I'm going to look for any signs of pregnancy and or complications. Then I'm also going to be looking for subcutaneous emphysema. I can't even see my face. So I'm going to move on to the pelvis. I'm going to be assessing for a DCAP BTLS. I'm going to palpate for tenderness, instability, and crepitus. Sorry, I'm like really tired. Just for a moment. So I'm going to check for the femoral pulse. Right here, right? I'm really looking. Thanks. I'm going to check for the femoral pulse. Any incontinence, which is lack of control, so of the bladder. Then if I had a male patient, I would be looking for prepism, which is an erector. What's that thing called? Oh, whatever. So she's not a male patient, so I don't have to look for prepism. Because she's a female patient, I'm looking for any signs of pregnancy and or complications. I'm also looking for vaginal bleeding. So moving on to my lower extremities. Dude, I can't feel my legs right now. I'm gonna assess for DCAP BTLS. I'm going to palpate for any tenderness, instability, or crepitus. I'm going to be looking for track marks or tattoos, any medical alert bracelets. Then I'm going to check the pedal pulses. pretend there's no shoes. Then I'm going to look for motor movement. So can you push down? Can you push up? Can you push down? Can you push up? Okay, which toe am I touching?
My big toe.
Okay, which toe am I touching?
My small toe, my pinky toe.
Okay, so I checked for motor movement and sensation. Then I'm going to go on to the upper extremities. Come back up. I like these. I'm going to be assessing for DTaP BTLS. I'm going to palpitate for any tenderness, instability, or crepitus. I'm looking for tattoos or track marks. I'm also going to be looking for any medical alert tags. Then I'm going to be checking the brachial and the radial pulses. Okay. Then I'm going to be checking for the motor movement. So can you squeeze? Okay, can you squeeze? Okay, without closing your eyes. Okay, what finger am I touching?
My pinky finger or my small finger?
So without opening your eyes, what finger am I touching?
My thumb.
Okay. I'm really tired. So I'm going to move on to the back. So okay, woman, you're like almost dead. Okay, how do I do like this? You have to go all the way.
I know.
Okay, so when you do your video, you gotta go. Okay, woman. That's so not. Woman, put your thing straight. There you go. Okay. I'm going to be assessing for DTaP BTLS. I'm going to palpitate for any tenderness, instability, or crepitus. I'm also going to be looking for tattoos. Okay. I'm going to be looking at the brachial and the radial pulses. I'm going to be looking for subcutaneous emphysema and then sacral edema. Okay, so that is our detailed physical examination.